Hello, I'm Dr. Graham Teague from the Back Pain Advisor. The following is a little simple self-test that you can apply to find out if the X-Pain method is the ideal tool for you to use to remove your back pain, but also for those people not experiencing back pain to help remove distortion patterns that may lead to back pain in your future. If at any time during this test you notice any back pain, I want you to stop because it means the test is positive. But on to the tests. The first test is called the mirror test. What I want you to do is go and stand in front of your mirror. While you're standing in front of your mirror, you look for postural distortions. You may notice that one shoulder is higher than the other. You may also notice that one shoulder is turned in more, or the gap between your arm and your body is greater on one side than the other. Also, if you place your hands on your hips, you may notice that one hip is higher than the other side. If any of these happen, it means the test is positive. This means that you have postural distortion patterns that are usually coming from muscular imbalances, muscles that are tight, but also muscles that are also weakened in your structural system. And if this is the case, the X-Pain method is the ideal tool to help remove these distortions. The second test is called the lie down test. What I want you to do is to lie on your back and slide the back of your hands under your low back at the belt height. When you do this, you may notice two things. Firstly, it is easier to slide one hand under the back compared to the other side. And secondly, you may find that there is more weight from your back on one hand than the other. If this is the case, then it means that you have pelvic distortion. When your pelvis twists, it means your spine's twisted, and it means that there will be certain joints within your spine that are not moving as freely as they should do. The X-Pain method gives you the ideal tools to realign your spine, to align your pelvis, and to remove any joints that are not moving as freely as they possibly could. The third test I want you to do is called the straight leg raise. With this test, I want you to be very gentle. If at any time there is back pain, I want you to stop and rest, because it means the test is positive. So what you do, again, is lie on your back. I want you to raise one leg at a time, up as far as you possibly can, gently and easily. And then I want you to rest that leg and replace it by lifting your other leg also as high as you possibly can. What you may notice is that one leg is easier to lift than the other. You may notice that you can lift one leg higher than the other side, or you may find some minor discomfort when you lift or descend your leg. If this is the case, then the X-Pain method is the ideal tool for you. In this situation, it means the joints in your low back and the muscles that support those joints are not moving as well as they should do, and the muscles are tighter than they should do. The X-Pain method is the ideal tool to remove this sort of distortion pattern. The fourth test is very simple. If you suffer from low back pain, sciatica, upper back pain, neck pain, leg or arm pain, then the X-Pain method is the ideal tool for you. You see, the X-Pain method is packed full of not just stretches, but strengthening techniques and ways that you can realign your spine and get not just your pain gone now, but removed forever. The X-Pain method is the ideal tool for you. So what I want you to do now is to go back to thebackpainadvisor.com and go and order the X-Pain method now and become pain-free.